According to the latest estimates from the World Health Organization, more than 300 million people are now living with depression, an increase of more than 18% between 2005 and 2015. Lack of support of people with mental disorders, coupled with a fear of stigma, prevent many from accessing the treatment they need to live healthy, productive lives. Lydia Phillip Jones, Acting Senior Health Promotions Officer in the Ministry of Health, says depression has no boundary.
Basically, what we need to let people know is that depression is basically an illness that can affect anybody. It doesn't have to be anybody of a particular age. It can be young people, old people. It doesn't have to be men as opposed to women. That everybody can be affected by depression. Yeah, and that it's a course that anybody can go through, and that with the right treatment, persons can get over it and can continue with their lives normally. I think that is the take-home message.
Ms. Phillip Jones spoke about activities planned to mark Grenada's Health Week.
The theme for this year for World Health Day is Depression Less Talk, and the theme is geared towards highlighting the importance of persons being aware of depression and what the causes, the effects, and to basically let people know that depression is basically an illness like everything else, and that it can be prevented and as well as it can be treated, and not necessarily meaning that you would have to end up in let's say in a psychiatric facility or so, but is that it can be treated, and it's things that, and it's a course of action as a natural cause of disease, if you can say that people go through, and it's not necessarily that when you're depressed or you're treated for depression is the end of the world and you have to give up all.
One of the planned activities will bring more focus on the island's lone mental institution.
We are looking to install and unveil a signing board that would direct people to Monge Hospital, because we realize that there's not a sign that actually says this way to Monge Hospital, so we're looking at that. We're also looking at doing some beautification up at Monge Hospital, looking at doing some repainting and brightening up of some day rooms where the patients actually go and do some occupational therapy. We're also looking at beautification in terms of planting some oriental plants, pretty plants, so that they at least brighten up the place for them.
Ms. Phillips said they have also produced bumper stickers highlighting the issue of depression, encouraging people to talk about it, and those affected to seek help. On the 6th, there will be a community walkabout and depression screening in Victoria St. Mark. Here's how you can identify someone with depression.
Persons who are constantly in a state of in a sad mood, lack of sleep, maybe lack of sleep. Like I said, they're over sad, taking long to come out of a situation, a sad situation. Yeah, feeling of hopelessness, helplessness. They lose interest in like daily activities. There may be changes in their appetite or their weight. Some people have changes in sleep. Some people can't sleep. Some people sleep a lot more than they used to, like all during the day they're tired. Persons will be angry and irritable. They lose energy. Persons have a sense of self-loathing, or they hate themselves. They have problems in concentrating. There can be even signs of unexplained aches and pains. Everything hurting them, but they don't have an injury, but they have like complain of, pain, aches and pains.
Cherry and Blackman Stephen, GBN Health.